Belly fat is really dangerous for you, and it's dangerous because it actually increases your risk of certain illnesses, especially chronic illnesses, and those that could have been prevented if you had just lost those 20 or 25 extra pounds that your body is carrying with itself. The fat cells in your body, especially around your belly area, the belly fat, is really dangerous. And it's dangerous because it actually does two things. The first thing it does is it actually increases your insulin resistance. Fat is notorious for absorbing hormones, and because it is so notorious for that, it actually leads to an insulin resistance in cells by developing a fatty coating on the surface of the cells. Insulin receptors are not efficient enough to bind with the insulin that has been circulating in your body. So now you need more and more insulin to produce the same effect of taking that glucose from the blood into the cells. Because of this higher insulin resistance, you now have prediabetes, and you have a risk of developing type 2 diabetes in the future, which actually increases your risk of heart disease and stroke as well. The second thing that the fat cells do is they release harmful cytokines. Cytokines are actually inflammatory mediators of the immune system, and they actually cause inflammation widespread throughout the body. Now, because of this widespread inflammation throughout the body, the insulin resistance actually makes things worse. So number one that we just discussed was that high amount of belly fat or visceral fat increases your risk of diabetes mellitus. The second is hypertension. In April of 2017, there was a research done on 10,000 Chinese students, and it showed that by just increasing the waist circumference by 5%, there was an increased chance of hypertension in about 34% of the males and about 28% of the females. It has even been shown in many studies in hypertensive people that if they just reduce their waist by 2 to 3%, or they decrease their weight by about 5 to 10 pounds, their reading in the systolic blood pressure would come down about 10 or 12 milligrams of mercury. That is really beneficial if you are trying to control your risk of hypertension. Now, this increased hypertension can actually cause congestive heart failure or right-sided or left-sided heart failures, leading to edema and many other health conditions. And this is because of the added stress on the heart attack or myocardial infarction. And that happens because of the widespread inflammation that these cytokines produce on inside of the vessels. Because of these glycated proteins and these higher levels of triglycerides in your blood, you now develop atherosclerosis and arteriosclerosis that actually narrow down your blood vessels. Because of the narrowing down of your blood vessels, the heart has to pump more forcefully than it had to before, and it also causes hypertension. Now, because of these narrowing blood vessels, the blood vessels that supply the heart itself, or the coronary arteries that supply the cardiomyocytes, are now clogged. If a cardiomyocyte or a certain part of the heart is not getting enough oxygen supply, well, guess what? You would have chest pain or angina, and it is because of the myocardial infarction that has happened due to a constricted or a blocked coronary artery. And then we have to perform procedures like coronary artery angioplasty or a bypass surgery so that we can graft another vessel that can bypass that specific coronary artery that has been clogged. This is dementia. And dementia is a byproduct of sustained hypertension. If you are hypertensive chronically, or you have a waist circumference of greater than 40 inches for a man and about 33 to 34 inches for a female, you actually have a greater risk of developing dementia. And that is because these cytokines produce widespread body inflammation, and cholesterol and many other fatty end products get clogged up in spaces of your brain, especially called the ventricles. Because of this happening and the high blood pressure constantly damaging those neurons and the high CSF putting a pressure on the brain, that actually increases your risk of dementia. About 30% of hypertensive people develop dementia in later stages of their life. And if you want to reduce your chances of dementia, you should actually reduce your weight and reduce your added sugar intake, especially in processed food that has very low amounts of fiber. Number 5 is cancer. Cancer is a killer for sure. And the food for cancer cells or tumors is glucose. Because you are consuming so much sugar, you have a lot of belly weight. And people that have a lot of weight on their belly and on their viscera is because they consume a lot of sugar. People that consume a lot of other foods get even fat distribution. But those that consume added sugars have a specific fat distribution that is a pear-shaped belly. And that adds on to the risk for cancer, because fat actually is a fuel for cancer, because now your immune system is down and you cannot suppress these tumor cells. You have to provide additional supply to your adipocytes, and that is putting a lot of pressure on your circulatory system. Those immune cells cannot spread throughout your body to counter the tumor cells that are producing, and the excessive eating of sugar is actually fueling the tumor cells. So fat or obesity is actually a risk factor for cancer. Ladies that have a waist circumference of about 33 inches or greater have 4 times more risk of developing endometrial cancer than ladies who had a waist circumference less than 32 inches. I have a lot of specific videos about how to lose belly fat and how to lose fat overall on a keto diet, on an Atkins diet, or on a calorie restriction diet. Make sure you check out my playlists that I have made specifically on how you can decrease your belly fat and how you can decrease your weight. Thank you so much. If you like the video, consider dropping down a thumbs up or commenting down below if you have any queries at all, or if you want me to make a video on a specific topic.